Second white coat. Subscribe and like. Let's learn medicine together.
You know, sometimes the biggest mysteries come in the smallest packages. Today, we're going to be medical detectives. We're diving into a case that starts literally moments after a baby is born. The clues? They're all hidden in plain sight, in the way a tiny arm is held. So, let's get into it. Okay, so here's the situation. We've got a newborn girl, just a couple of days old. The first thing we learn from the case file is that she had a difficult delivery. Now, her parents are noticing something really concerning. Her right arm just isn't moving as much as her left. And for us, well, that's not just a worry. That's our first big clue. All right, and this is where the real detective work kicks in. Just take a look at the baby's arm here. It's not just that it's weak, it's held in this very specific, kind of strange position. See that? That's not random. That's a huge signpost, and it's pointing us right toward the answer. And believe it or not, this posture has a name. So what's the first thing you do in any investigation? You got to gather the facts, right? So the doctors get right in there, taking note of every single little detail about this arm. And wow, the details are super specific. The arm isn't just floppy or limp. No, it's held tight against the body. The elbow is straight, kind of locked out. The forearm is turned inward, and the wrist is bent. Every single one of these observations is another piece of the puzzle. Okay, so what does all this mean when you put it together? This specific combination, it's not a coincidence. It's like a code, and we are just about to figure out what it says. It turns out this posture is so well known, it actually has a nickname. It's called the waiter's tip posture, and it's pretty descriptive, right? Just picture a waiter trying to be discreet, holding their hand back for a tip. That's exactly the position. And that little name, it's the key that's going to unlock this entire case for us. Let's actually break this down, piece by piece, so it makes sense. First, the shoulder. It's pulled in and twisted inward. Why? Well, because the muscles that are supposed to lift it out and rotate it outward aren't getting the signal to work. Next, the elbow is extended, it's straight. That's because the muscles that bend it are weak. And finally, the forearm is pronated, or turned so the palm faces back, because the muscles that turn it the other way are out of commission. It's a classic battle of the muscles, and the ones that are still working are winning, pulling the arm into this very unique position. So, that posture points us straight to the diagnosis, Erb-Duchenne Palsy. And it's super important to understand this isn't a problem with the muscles themselves, it's a nerve problem. The source is a bundle of nerves in the shoulder called the brachial plexus. Think of it like the main electrical panel for the entire arm. Okay, great, we've got our diagnosis, so now we have to put on our electrician hats and trace the wiring back to find exactly where the circuit is broken. And our investigation leads us to a very specific spot, the very top of that brachial plexus. The damage is to the C5 and C6 nerve roots. These are the first two nerves that come out of the spinal cord in the neck to form that bundle. And an injury right there, it explains everything we've seen so far. It's a perfect cause and effect situation. You see, those C5 and C6 nerves are in charge of a few key jobs: lifting the arm away from the body, bending the elbow, and turning the palm up. So if you damage those nerves, well, you lose those abilities. And the muscles that do the exact opposite things, the ones that pull the arm in and straighten the elbow, they don't have anything fighting against them anymore. They just take over. And boom, you get that classic waiter's tip posture. It all clicks into place. But you know, a good detective never settles for just one piece of evidence, right? You need to confirm your theory. And to do that, doctors have this amazing tool to test nerve pathways, and that's the reflex test. And this is really where they lock the case down. They check the baby's reflexes. First, the Moro reflex, that's the startle reflex where a baby throws their arms out. On the right side, it's absent. Why? Because that arms out motion is controlled by C5 and C6. But now, here's the kicker. The grasp reflex, where the baby squeezes a finger, is totally fine. That's because the grasp is controlled by different nerves, lower down. So what does that tell you? It tells you the injury is isolated. It's only a C5, C6 problem. It's incredibly precise. So just by looking at which reflexes are there and which ones are gone, doctors can pinpoint the location of the injury with amazing accuracy. They know it's not some massive problem with the whole arm or the spinal cord. All the evidence points to one spot, the C5, C6 nerve roots. So the what is solved. Now we just need to figure out the how. We know exactly what the injury is and where it is, but how in the world did it happen? Well, for the final piece of our puzzle, we have to go all the way back to the beginning of the story, back to the delivery room. Remember how the case file started?
A difficult delivery? That wasn't just background info, that was the key. This kind of injury very often happens when the baby's shoulder gets stuck for a moment on its way out. To help get the baby delivered, the head and neck might get stretched to the side, and that stretch can damage those really delicate C5-C6 nerve roots right where they exit the neck. Suddenly, it all makes perfect sense.
And just like that, our medical mystery is solved. That waiter's tip posture is basically the signature move of an Erb-Duchenne palsy. And we know it comes from an injury to the C5-C6 nerve roots, often during a tough delivery. It's just an amazing example of how our bodies send out these crystal clear signals. You just have to know the language. It really shows you that sometimes the answers to the most complicated puzzles are right there, hiding in plain sight.